Hi, I'm Alana Hippensteel from Pharmacy Times. Before we get started, one of our top articles today discusses how children, teens, and young adults are at a greater risk for severe complications from COVID-19 than previously understood. There's more of that on pharmacytimes.com. Today, I'm speaking with Dr. Benjamin McNabb, the owner and pharmacist of Love Oak Pharmacy, on the path ahead in reopening pharmacies like his own in rural Texas. So, Dr. McNabb, when will Love Oak Pharmacy be reopening?
We're actually anticipating next week, beginning of June. We are closely following the recommendations coming down from Governor Abbott of Texas, and there's been a significant push lately to try to get businesses reopened in Texas. But I think pharmacy is a very special case, and so we're doing everything we can to self-regulate ourselves a little bit, maybe be a little bit more proactive than other types of businesses. And so we're excited to get this place reopened, to allow people to start coming back in. But we're definitely keeping an eye on everything very strictly.
Excellent. What have you been doing to prepare for the reopening process?
We've been doing quite a bit. Things include preparing signage for the front door for people waiting in line, because we haven't had people wait at the front counter yet. So trying to prepare where people 6-foot distance from each other while waiting. We're also preparing appropriate amount of PPE for our employees and for our other staff. We also, let me take a look here. I want to make sure I hit everything. I think another interesting thing that we've been preparing for is an increased demand for flu vaccine.
Right.
And so we have been diversifying our wholesalers that we're acquiring that from, and making sure that we order a little bit more this year than we might have previously expected. We also are preparing contingency plans. So if we do see upticks in COVID cases in the community, once most businesses are starting to open up, we have contingency plans such as having 2 separate pharmacy teams that have no overlapping schedules to allow for, to eliminate the possibility of contaminating our entire team if we had to quarantine. So that's in place as far as policies and procedures. We're also looking at things like COVID and flu testing. We are CLIA waived, and we've been doing flu and strep tests in the past. I think COVID definitely complicates this. We are doing what we can to prepare for COVID testing, and we believe once flu season hits, it'll be possibly a much more complicated situation than we're used to. So we're preparing for that as far as protocols, PPE, exact policies, possibly doing it in the parking lot, having them call ahead, not really allowing people in the pharmacy if they're feeling sick, but addressing it outside in a controlled fashion. I think we're also doing some interesting things that I hadn't thought about before, like credit card storage, trying to make transactions touchless. And so recently we've discovered the ability in our software to store those credit cards. We almost have 100% acceptance rate from the patients. They seem to love it. And I think it also makes our transactions faster and easier for us. So in the long term, it benefits us in other ways besides making transactions touchless. I think one thing that we've really increased is the number of people on med synchronization and adherence. We think we can drastically limit the number of transactions and limit potential exposure to patients. So if we can help them come once a month or less often to the pharmacy, then we're doing a lot to improve their care at reducing the risk of COVID infection. Another thing that we've been working on in the background is addressing those COVID testing and flu testing regulations at our state level. And so trying to be very proactive at preparing for pharmacists to be able to order, not just administer, but also order tests in Texas. And so we want to hit that front from flu and from COVID. So we're trying to be very comprehensive with that, with our advocacy groups. And lastly, there's a lot of misinformation and things in social media and the news, and trying to find reliable news. And I think it's very critical right now for for pharmacists to do everything they can to be that reliable source of information during this. And so we're expecting to shoot some video content, put it on our social media channels, and explain why we're going to be requiring masks as they enter, or sanitizing their hands before they enter, and make sure that they understand that we care about them, that this is not necessary. There's a lot of people that believe this is a hoax in my area. So just doing everything we can to address those issues as well as far as the community goes.
Right, right, absolutely. So what has been your approach to managing COVID-19 guidelines for both pharmacies and restaurants when reopening, since there's also a restaurant in your store?
Right. We have a restaurant. We also have a self-serve frozen yogurt bar. So
Right.
it's an interesting situation. And so what we're doing to address this is we're going to have a greeter at our front door, at least for a period of time until we hear otherwise from the CDC as far as those changes goes. And so our greeter will be informing people of the mask requirement, because we are a pharmacy. We want to follow the CDC recommendation that all people entering a pharmacy must wear a mask. So we're going to ask them to enter with a mask. If they do enter, we will help them make sure they sanitize their hands. So we have hand sanitizer ready, and so that greeter will help them with that. They will also do a simple screening question if they're feeling sick. We especially recommend that they stay in their car, let us do their shopping for them. We'll bring out their prescription to curbside or use our home delivery or drive-through. And so we're going to try to be targeted in our approach, and do it tactfully. We do want people to still use our business and not be upset that they can't enter, but we believe that people will mostly take it that we care about them and we do want them to come in, but they should understand that we have recommendations from the CDC we need to follow as a pharmacy.
Yeah.
As far as our restaurant goes, there's other requirements like currently in Texas, occupancy. So we're going to monitor our occupancy, building occupancy, to keep that limited. Our tables will be spread out a certain distance to help with social distancing while people eat. Our self-serve frozen yogurt bar will be only available to made to order by restaurant staff. And so we're going to do everything we can there. As far as those other things like sanitizing bathrooms after every use, we'll have other staff dedicated to extra cleaning. We will have appropriate sanitizing supplies available at the registers. And another thing that we are concentrating on is keeping our staff segregated to certain workstations, and as they're switching between workstations, they need to sanitize. And so trying to prevent those people from spreading to each other as well is very important to us.
Absolutely.